Hello, gentlemen. If you're over 60 and have noticed that something has changed during your intimate experiences, specifically that familiar peak of pleasure is there, but the release of seminal fluid is missing, then this message is important for you. Perhaps it happened once and caught you off guard, or maybe it's been happening consistently and you've kept quiet, uncertain, or even embarrassed. I'm Dr. Samra, a urology specialist with over a decade of clinical experience in men's health. Today, I want to speak directly and honestly to deliver information that could not only put your mind at ease, but potentially change how you view this phase of your life. What you're experiencing is not a threat to your masculinity. It's a signal, one that your body wants you to understand clearly. Stay with me, because over the next few minutes, we're going to explore what actually happens when ejaculation seems to disappear, what causes it, what you need to watch out for, and most importantly, the modern, science-backed solutions that can help you regain your sense of control, energy, and well-being. Before we get started, take a moment to subscribe and share your thoughts with us. Let us know where you're joining from. It's always inspiring to see men from all over the world coming together, supporting one another, and taking charge of their health. Let's begin by understanding what occurs under normal circumstances. Ejaculation, as many don't realize, is a complex yet beautifully coordinated event. Within the male reproductive system, the testicles produce sperm, while the seminal vesicles contribute the majority of the fluid, rich in nutrients. The prostate, in turn, adds a protective component to this mix. This fluid is delivered into the urethra, and during climax, specific pelvic muscles contract in rhythmic waves, propelling it outward. This process, while rapid, depends on an intricate balance between nerves, hormones, glandular secretions, and muscular control. It's crucial to separate two terms here: climax and ejaculation. While most men experience these simultaneously, they are actually governed by separate biological mechanisms. Orgasm is primarily a neurological experience, the peak sensation of pleasure, while ejaculation is the physical expulsion of semen. You can have one without the other, and this distinction is at the heart of today's topic. When a man reaches orgasm but finds that little to no semen is released, this is known medically as anejaculation, or more commonly, dry ejaculation. Though the pleasure remains, the absence of fluid can be disorienting, sometimes even unsettling. I've had patients describe it as an empty orgasm. It often leaves men anxious, unsure of what's happening, and reluctant to raise the issue, even with a healthcare provider. Let me reassure you, the pleasurable sensation itself, which is regulated by your nervous system, is still intact. The issue lies in the mechanical side, the physical release, and several identifiable causes may be responsible. Let's take a closer look at the most common ones. The first and most frequent cause is retrograde ejaculation. Imagine there's a small muscular valve at the junction where your bladder meets the urethra. Ordinarily, this valve closes tightly during climax to prevent semen from flowing backward into the bladder. If it doesn't close properly, the semen takes the path of least resistance. It flows into the bladder rather than being expelled. The result? A pleasurable climax, but no external release. A helpful sign to look for is cloudy urine after intercourse. This is because the semen has mixed with urine and is flushed out during your next trip to the bathroom. This condition isn't random. It's commonly seen in men who've undergone prostate or bladder surgery, especially procedures for enlarged prostate (BPH), since surgical interventions can affect the nerves or muscles that control this valve. Moreover, specific medications used to manage hypertension, depression, or anxiety, particularly those in the alpha blocker or SSRI class, can relax the sphincter involved, leading to retrograde ejaculation as a side effect. Neurological disorders also factor in. Long-standing type 2 diabetes, for example, is known to impair autonomic nerve function, which can disrupt this mechanism. Other conditions, such as spinal cord injuries, multiple system atrophy, or early signs of neurodegenerative diseases, may affect the same pathway. I recall a patient of mine, a gentleman in his late 60s, who came to me deeply concerned after prostate surgery. When we identified this as a mechanical side effect and he realized it didn't mean his sexual drive or masculinity was lost, it was as if a weight had been lifted. For most men, once the root cause is understood, the emotional relief is immense. Now, how do we confirm retrograde ejaculation? Through a simple test, a post-ejaculation urinalysis. If sperm is found in the urine, the diagnosis is confirmed. While it may impact natural conception, it typically doesn't affect the enjoyment or frequency of your intimate life. Let's explore another, less talked about reason for dry ejaculation: physical blockages in the ejaculatory pathway. Here, the seminal vesicles, the glands supplying the majority of the ejaculatory fluid, are producing normally. But if there's a blockage in the distance between the vesicles and the urethra, semen simply can't pass through. It's akin to a traffic jam on a major highway. No matter how many vehicles are ready to move, they can't go anywhere if the road is blocked. These blockages are often caused by scar tissue from past infections, such as untreated prostatitis. Tiny stones, similar to kidney stones, may also form in this area and plug the duct. In some cases, congenital cysts or anatomical variations can create the obstruction. Men may not always notice this immediately. Over time, they may find their ejaculate has become significantly reduced, thicker, or absent altogether. Some may feel a dull discomfort during climax or in the pelvic area. Diagnosing these issues often requires imaging, typically a transrectal ultrasound, a sophisticated yet non-invasive way to examine the seminal vesicles and associated ducts. The silver lining? Many of these blockages are treatable. Depending on the cause, your urologist may recommend medications to reduce inflammation or perform minimally invasive procedures to restore normal flow. A third crucial factor in dry ejaculation is hormonal balance, specifically involving testosterone. This hormone is not only responsible for libido and sperm generation, it also plays a pivotal role in maintaining the tone and functionality of the prostate and seminal vesicles. As testosterone levels decline with age, a condition known as late-onset hypogonadism, men may first notice subtle changes: reduced ejaculatory volume, diminished orgasmic intensity, slower recovery time. Over time, this drop may extend to other areas: reduced energy, loss of muscle tone, emotional shifts such as irritability, and even depression. The mistake many men make is assuming this is just normal aging. In many cases, it's not. Low testosterone is a diagnosable and treatable medical condition. A simple blood test can measure hormone levels, and if a deficiency is confirmed, options like testosterone replacement therapy, TRT, can offer profound improvements, not just in sexual health, but in overall quality of life. That said, I must also stress caution. While the most common causes of dry ejaculation are benign and treatable, in some cases it may signal more serious underlying conditions. Urological cancers, such as prostate or bladder cancer, can physically obstruct the ejaculatory ducts. If you notice other red flags, blood in your urine or semen, consistent pelvic pain, or sudden changes in urinary habits, don't ignore them. These are warning signs that warrant urgent medical evaluation. Likewise, neurological disorders, including Parkinson's disease, multiple sclerosis, and complications from diabetes, can interfere with the brain's ability to coordinate sexual function. When ejaculation disappears alongside other symptoms, numbness, weakness, loss of genital sensation, these should never be dismissed. If you're experiencing sudden onset dry ejaculation, especially if combined with pain, fever, blood, or numbness, seek prompt medical attention. These symptoms are not part of normal aging. They indicate something more serious. Beyond the physical, let's acknowledge the emotional toll. Ejaculation often carries symbolic meaning for men. It's linked to performance, identity, even self-worth. When it changes or disappears, many experience frustration, embarrassment, even depression. Some begin pulling away from intimacy altogether out of fear they are no longer enough. This mindset is not only harmful, but untrue. The absence of semen does not equate to a loss of masculinity. You are not less of a man because your biology has evolved. What matters is understanding the change and taking action, communicating with your partner, being honest with your doctor, and staying proactive in safeguarding your health. So what can you do starting today? First, listen to your body. If you've noticed dry ejaculation, especially if it appeared suddenly, make an appointment with a urologist. Early diagnosis allows for better outcomes. Second, Manage health conditions that quietly erode sexual function, like diabetes, high blood pressure, and obesity. These issues compromise nerve, hormone, and blood vessel health. Third, invest in the basics: a balanced diet, consistent exercise, adequate sleep. Lifestyle habits are powerful. Even small improvements add up to big changes in sexual and overall health. Fourth, break the silence. Speak up with your loved one, with a medical professional. The more transparent you are about what you're feeling, the faster and more accurately we can help you. And finally, follow a guided treatment plan. Whether it involves medication adjustments, hormone therapy, or lifestyle alignment, having a structured approach turns uncertainty into confidence. To close, dry ejaculation is not the end of your intimate life. It's simply a change, a shift that can reflect something mechanical, hormonal, obstructive, neurological, or in rare cases, more serious. But in every scenario, knowledge is your most powerful ally. I've seen countless men reclaim their vigor, intimacy, and emotional well-being, not by ignoring the signs, but by facing them head-on. Always remember, your value isn't measured by physical output. What defines you is your strength, your health, and your willingness to grow through every chapter of life. If this message resonated with you, please share it with someone you care for: a friend, a father, a brother. You never know who might need to hear these words. Like, subscribe, and stay connected for future insights on men's health. Because living longer isn't the goal, living well is. I'm Dr. Samra. Stay informed, stay empowered, and above all, stay healthy. Your best years are still ahead.